at the mini congress that was organized in Tagapera. When was it? 2 or 3 years ago. Were you there? When was it? Yes. So we had, of course, a long time to speak about the production because it was 2 days. Thank you very much. Thank you. So, a very basic clinical case that you can have every day in your practice. I guess that this breed, you probably have it in Estonia, this Icelandic sheepdog. In France they are not so popular, they are just beginning, maybe there are 20-25 of them, and you know that in the Scandinavian mythology, Hugin was the messenger of the god Odin, and he was together with Munin. And in fact this dog is living in Paris, so it's a purebred dog, it could be a crossbred, a mongrel, whatever. It's 1.5 years old, and it comes to see you for vaccination, normal consultation. So you speak with the owner, and you see that this dog lives alone, but there are several bitches in the building. And indeed, in France, you know, we are one of the countries in Europe where the density of pets is the highest compared with the number of people, especially in big cities. And of course, this dog is not per se intended for reproduction, but the owner doesn't know. Of course, it's a purebred dog, why not? So you take the history. The dog lives in the city center, the center of Paris. And since he had been older, at puberty, he began marking with the urine quite a lot, peeing, when he's walking the dog outside in the streets of Paris. And one of the things that the dog likes very, very much is to pee on car wheels. So of course it's good if the owner of the car is not here, but if the owner of the car comes, they are not so happy. So once or twice there were some very strong discussion between the people. And what annoyed very much the owner is that the dog tended to be more and more aggressive towards other males, and especially Yorkshire Terriers. I don't know why, but he hates Yorkshire Terriers, and always tries to attack them. So the clinical examination is okay, and then you discuss with the owner about all these problems. So of course you speak about the surgical castration. So the interrogation point is for you. Is it the best solution for this dog? So please raise your hands who think yes, it's the best solution. About 25%. So it means all the others think it's not the best solution. So there may be another good solution. So let's think about surgical castration. First, what is the effect on urinary marking? So who among you, and raise your hand again, think that it will solve this problem of urinary marking? I say solve. Please raise your hand. 1 person, 2 persons, 3 persons, or 5. So we don't have the 25% of people who thought that it was the best solution. So in fact, you are right. All the studies, and there was a PhD defense last week in Paris about this aspect, and in fact it was from a behaviorist. On urinary marking, most castrated dogs tend to have a less intense marking. So maybe they are going to mark 10 times instead of 25 times when they are walking. But most of them will still mark, whatever the age of castration. So it will not solve entirely the problem of discussion with the owners that are not happy that the dog is being on their car wheel. But it may be better. Do you know approximately the percentage of dogs after castration that are going to pee like a female? take the posture of sitting and be like this, male dogs. Have you seen some of them after castration doing this? Yes, they are. Depending on the reports, it's about 8 to 10%, especially dogs castrated at a young age. So this is something, of course, you have to tell the owner, if you castrate a dog, that many dogs will still be normally raising their back feet as normal dogs. Concerning the effect on behavior towards other males, who thinks it will solve the problem? Some people will say yes. This lady, you said at the beginning, more or less. So I think the answer is once again, we say that Swiss people, they always say maybe yes, maybe no. So we can make a Swiss answer, maybe yes, maybe no. It's not sure. And so once again, about 50 to 60% of the males are clearly improved in their intra-male aggressivity, but some of them don't change at all. And probably there are some further studies to be done, but it may depend on the age of castration. So all this to say that the 25% of people in this room who think it's the best solution, maybe they are right, but not entirely. We don't know. The problem of surgical castration, it's irreversible. Once you have removed the testes, you are not going to put them again, of course. And this is something more and more important nowadays, especially in big cities like Paris. And people consider as a mutilation to castrate a dog. Many dogs now are part of the family, like a child. They do everything, and of course you would not imagine castrating your child. And so these people are very upset about the idea of their pet having pain. And maybe they said, well, he's going to be angry after me after that, he will see me as a bad person. And especially there are some tendencies coming from the north of Europe. You are nearly a Scandinavian country, and you know that in some countries like Norway, for example, it's forbidden to castrate an animal if there is not a medical reason. So, and this is pushing very much, especially among young owners who have a lot of consideration for their pets, to consider it that it's not ethical to castrate an animal. And furthermore, of course, there is the risk of general anesthesia. We are afraid for ourselves when we go on surgery, and the owners, they are afraid for their pets also. Are there side effects of castration, surgical castration? Which side effect what comes first to your mind? Yes, gain weight, obesity. Of course, not all dogs will be transformed into Vietnamese pigs, at least I hope that, because you will give some nutritional advices, but there is a danger. Many dogs castrated put on weight, so we have to be careful. Are there other side effects? For example, on the fur, yes, you say yes, so what is the side effect? Yes, it's exactly this. It's what it's called puppy coat. So in fact it's in middle or long-haired dogs, of course not all of them. It tends to be more frequent in females, but it happens in males also. The hair after castration becomes very ugly, very curly, looking like wool, like juvenile fur. It's what dermatologists call the puppy coat. You have it in golden retrievers, in cocker spaniels, in Afghans, in Belgian shepherds, breeds like this. Have some of you seen it? Can you raise your hand after castration? You see, it's not so rare. Several of you have seen this case, and sometimes you don't realize it's linked to castration. And just to say a word about the product we are going to speak about, which is suprelorin, which is a GnRH agonist, it can help to solve these problems in about 50 to 80% of the cases, depending on the reports. It's our colleague Iris Reicher from Zurich, which has worked quite a lot on this. Did you try suprelorin on the report? No?
You warned witness before that they might have to change the way they care for the goat, usually if they took the dog back.
So anyway, you know that you can try eventually suprelorin for this. So second option could be vasectomy. Who among you is performing vasectomies in dogs? None. So it would be the same for me. In a way, it's stupid because the dog, of course, is not fertile, but is not castrated, so he will pee the same, he will hate Yorkshire Terriers the same, it will not change anything. The only thing is that he will not be able to produce puppies. So, of course, the last option is suprelorin. I know you have the two forms of suprelorin in Estonia. So one subcutaneous implant which contains 4.7 milligram of deslorelin, and the other that contains the double, 9.4. How many of you have used suprelorin already? Not a lot. Maybe 10% among you. So in France now it's quite it's used a lot, and from the reports we had recently from Bierbach coming from Germany, it seems that now in Germany there are more male dogs that are implanted with suprelorin than surgically castrated. And it's the same in both Scandinavian countries, Norway and Sweden. So, in fact, how does it work? Suprelorin contains a GnRH agonist which is called deslorelin. So how does it work? You know that GnRH, the hypothalamic hormone, is the key factor of activating reproduction. It stimulates the pituitary gland, and the pituitary gland is releasing the gonadotropins FSH and LH, which activate reproduction in females and in males. And deslorelin, the GnRH agonist, has a more potent activity, a longer activity, and a higher affinity for the GnRH receptor due to the fact that two amino acids are substituted on the GnRH initial formula on position 6 and 9, and it increases the potency of the GnRH, so that's why it's called a super agonist. So in fact, there is a two-steps mechanism. It's very, very important to remember this. When you put suprelorin, you have an activation of the pituitary gland as an initial effect. So the pituitary gland is going to secrete FSH and LH, and you will get steroidogenesis and spermatogenesis in the male. It's what we call the activating effect or flare-up effect. The duration is about 1 or 2 weeks. In some dogs it can be up to 3 weeks. And in average about 70% of dogs have the end of this initial effect 2 weeks after implantation. So what happens after 1 or 2 weeks? There is still suprelorin that is released by the implant, but in the pituitary cells there is a post-receptor mechanism that has been studied quite recently, and after 2 weeks of continuous activating of the pituitary, the beta subunit of FSH and LH are not synthesized anymore. So suddenly there is no more FSH and LH. And we come to the interesting part for suppression of fertility, which is the second step, where you have a blockage and no more FSH and LH, so therefore no more activity of the gonads, and the animal will be medically castrated. So if we see what happens, so it's the desensitization period. If we see what happened in the male, and this is some data from the Australian people, this compound did one suprelorin has been released more than 10 to 15 years ago in Australia, so they have a long experience of this product. And you have here one placebo dog in dark red. So this dog is secreting testosterone normally with up and down, like testosterone, you don't have a very stable curve, depending on the months, depending on the time of the day, the level of testosterone is going up and down. And you have 10 dogs that have been implanted with suprelorin 4.7. So you implant them, and in the minutes that follow, you have an LH peak and then an increase of testosterone. And all these dogs have this big increase in testosterone. This is the flare-up effect. And then the testosterone will go down, and for the whole action of the implant, it will remain basal. That's why we have the right to speak about medical castration, because it's really a castration. There is no testosterone. And then you see, depending on the dog, and we will see the factors that play a role on this, some dogs will progressively have the testosterone coming back at various intervals depending on the individual sensitivity of the animal. So there is a suppression of testosterone secretion. We can say it's a real chemical castration. So what happens in the organism? Very quickly, you've got a reduced testicular size, which is good for the owner because he can see that really there is something happening in this dog. Sometimes the testes become very, very small. There is very quickly a reduced semen volume. Of course, most of the time you are not going to collect the semen. And in most dogs, you get in the first month an increase on the sperm defects, the sperm abnormalities. However, there is one Italian study by Stefano Romagnoli in which some of the dogs had no change of the semen quality during the first month. So therefore, there is a danger if the dog is mating in the month that follows implantation, that he may still fertile. So you have to tell the owner that the castration is occurring progressively. However, in all dogs, they become more or less azoospermic by 1 month, 1.5 months, and the libido stops. So they get the infertility in about 6 weeks. With the 9.4, it's a little bit longer because the kinetic of release of testosterone by the 9.4 implant is a little bit different. Therefore, the castrative effect occurs a little bit later than with the 4.7. That's why we don't recommend to implant the 9.4 implant at the first time in a dog. 9.4 has to be considered as a relay when you have already implanted a dog with 4.7. So first 4.7 and then eventually once a year 9.4 during all the life of the dog. So what happened in hugging? There was a diminution of the testicular volume in about 1 month. Diminution but no suppression of urinary marking. It was still like in the car wheels. Strong effect on intermale's behavior, but however, he still hates Yorkshire Terriers, really hates. And there was no effect on fur and weight gain because the nutrition was controlled. And of course, I know very well this dog because he is my dog. So I take a good example. So I know very well how we reacted to this. So how can you use this implant? You have an implanter that looks very much like the one you are using for microchips. And inside you have a blue translucid plastic rod. And so when you implant, after you can see that the implant is inside because you have the blue rod at the tip. So it's very easy to implant, it's not painful. Of course you have to disinfect a little bit the area of implantation. And in males, for this indication, suppression of fertility, it's very easy to use in the interscapular region. So, it was my case, in fact. What about if the owner wants to reproduce his dog later? What is the further fertility? And this has been studied quite well. We know that small dogs, less than 10 kilos, are in average inhibited in their testosterone secretion longer than medium-sized or large-sized dogs. So you see that the average for medium-sized dogs of inhibition of testosterone is about 300 days. So you will say, why do you speak about a 6-month duration implant? As you see, there was a dog in this study that was inhibited a little bit less than 6 months. So that's why it's, because there are individual sensitivity, it's wiser not to wait too long to reimplant a dog. Small dogs, miniature dogs especially, they can be inhibited very long, and so now it's recommended if you implant a very short Yorkie or a Chihuahua to tell the owner that maybe the dog will be inhibited very long. So this is something that comes from the field data, and we know this. However, when you implant only with one 4.7 implant, nearly 100% of the dog will have back a normal testosterone level 18 months, 1 year and a half after putting the implant. So it's reversible, and of course you have spermatogenesis. So spermatogenesis in the dog is about 8 to 9 weeks. So you begin to have testosteronemia usually 2 months after. There is one case in which it was 5 months after restoration of testosteronemia, but it's usually 2 to 2.5 months. And the normal fertility in average dogs is obtained about 60 weeks after implantation in average, but of course with big individual variations. So what happened in my own dog? So in fact, he had 9 months after implantation a normal testicular size, and he mated a bitch that she produced 3 puppies. That's one of the puppies, and since then he has produced another litter, also with 3 puppies. So, which is a normal size litter in this breed, in fact. But what about if I didn't want to mate my dog? Many owners are very happy with the implantation, they don't want to change anything. So there are some studies in which dogs have been implanted every 6 months with the 4.7 for a long time, more than 2 years and a half. And you see that except this dog, I will come back to it, all the dogs had a basal testosterone level during all the time of implantation and reimplantation. And at the end, when they stopped to be reimplanted, it's the red arrow, then the testosterone went back. So, in a way, that's fantastic. However, there are no published studies at the moment showing that there is a reversibility of fertility when you implant dogs so long. There are some studies in which dogs have been implanted 2 or 3 times, but after 3 times of reimplantation, I don't know if it works, maybe it's reversible, but I cannot say because there are no publications. What happened with this dog?